Hey Gary, gonna make this real casual. Just want to ask a few questions on how you're managing through this crisis, and I think it's best to let everybody know a little about your business model and how it's changed with COVID-19.
Yeah, sure. Thanks. Happy to join this morning, Rob, and thank you to the entire Brightree team for the work that you guys are continuing to do to support the provider base. You guys have been wonderful partners over the last month as this has unfolded. So Cape Medical Supply, we are based in Massachusetts. We operate in Massachusetts, Rhode Island, New Hampshire, and Maine. We're really a sleep company for all intents and purposes. We do have an orthopedic bracing line of business as well, but about 85% of our revenues are derived from sleep therapy products and services. And I think most Americans sort of watched this thing unfold through January and into February as just a citizen. And then, I think in late February, I really began to watch it more as an HME provider and with a growing sense of concern about what the impact was going to be here in the United States and how we would react as an organization. I think it was, as March sort of moved on, it was really the week of March 9th that we really began to plan for what we were going to do. And we went what we've termed far and fast. We made the decision March 12th to move all of our employees home and discontinue all patient contact effective the following Monday, March 16th. And I think that was met with some quizzical looks at first by our team, but we just had a tremendous sense of concern for what was happening, and we really wanted to get out in front of it. At this point, so it was really over that Friday, people left with their computers and their phones in boxes, and we kind of said goodbye and it felt very ominous, and I think in hindsight was clearly the right decision. We began contact with payer partners that same day, discussing our plans. They were very supportive of those plans and our ability to continue to service beneficiaries remotely. At this point, we've got 4 people in our warehouse manning our pick, pack, ship operation. One to 2 clinicians a day that are setting and shipping devices for new CPAP patients, CPAP and BiPAP patients. We've built out an extensive video library to support the initial adherence and compliance. And we have our clinicians and customer support teams working from home within their call queues, reacting. We had a daily management call up until yesterday, and it's gotten to be boring, frankly. We're going to switch to 3 times a week. We've learned a lot through the first several weeks of this, but the business is functioning largely as normal. It's been a credit to our management team and really a credit to all of our employees who have really embraced this challenge and are continuing to deliver a really high level of patient care across the 4 states. And the support from payers and referral partners has been fantastic. It's been uninterrupted service and care for us. We're learning and evolving every day, but we're very happy with that early decision, and the learning that happened throughout the first few weeks is helping us here as April rolls on.
Yeah, a couple of things stood out to me there is number one, to be able to react so quickly and to do it early in March and to get your people home and get them into a situation where they feel comfortable working from home. That's fantastic. A couple of things you talked about that came out to me were number one, patient care and taking care of your referrals. Talk to me a little about continuing to support your patients and your referral sources. What are you doing differently? How are you doing that? Because they certainly still need equipment and still need to be cared for.
Yeah, no, you're right. And first and foremost in our mind, early in March, there was the health and safety of our team members, and we reacted quickly to protect their health and safety. Second to that, a very close second was the continuing service of our patients and our referral partners. So it was really about leveraging technology, both telephonic and video technology, to support our patient base and make sure that they have the resources that they needed. And we've got a pretty large group of clinicians who, prior to that, March 16th, were out across those 4 states meeting face to face, and now they're in their homes and available for telephonic consults with the patients and walking them through and helping them orient to therapy. With respect to the referral partners, the first week was really about tweaking and fixing, and we were fortunate, I think, that this was not, and as I said to our team yesterday, this was not the result of a heroic weekend of work. This is years of investment in technology, partnering with great companies like Brightree. Our phone system as well was ready to go. Those people took the phones off their desks and plugged them in at home, and they were right away, right in their same call queues, ready to go. So we had the infrastructure in place that was ready to react to a situation like this. It wasn't done for this purpose, obviously, but it was focusing on the right partnership. So that first week, there was a lot of learning. The first weekend, so the weekend of March 21st and 22nd, I wrote a playbook for our referral partners to help them operate in a telehealth environment. Our referral partners, many of our referral partners are small businesses themselves, and they're struggling for how they're going to survive and take care of their patients in this environment too. And we felt like we had done a lot of legwork to build our own plans. We've done a lot of research. We were very closely following guidance from CMS and the commercial payers in New England. And we felt like we had some knowledge that we could impart on our referral partners. So we built out a playbook for how to leverage telehealth and home sleep testing in this new world. And our sales team began sharing that widely across the region, and it's been really well received by our referral partners, who are very appreciative to be partnered with somebody who's ready to react in this kind of environment, who has not only the health and safety of their team members and their patients, but also their partners in mind. So we need to pay attention to all of our constituencies in a situation like this. And it's been great to work with referral partners and help point them to the resources that are available, for them as a physician to continue to operate in this sort of environment.
Sure. Well, one quick follow-up to that is, how are you getting product to patients?
Shipping. So we have our own pick, pack, ship facility. With redundancy, we also partner with VGM for redundancy there. And so it was, that facility has had one of its busiest months ever in March. I think patients are very focused on hygiene and cleanliness in this sort of environment. And so what we were able to do is shift things around. In the midst of all this, of course, there was a Friday the 13th. And Friday the 13th, we built out a new supply shipment center within the pick, pack, ship facility to allow our clinicians, these are state licensed respiratory therapists, to work with devices and set them to the physician's requirements as dictated on the prescription. And we just added that as a component of the facility, and it meets all of the physical distancing recommendations that have come from the Massachusetts governor and the federal government as well. So it's just, it was a modification to an existing facility, but we were fortunate to already have a facility that was operating at, pretty significant scale. And we've learned a lot about, shipping new devices over the past few weeks here.
Well, I'm sure you have. That's great information to share. Appreciate that. Let's talk about treatment plans and specifically, if you do receive potential COVID-19 discharges or you're going to have COVID-19 patients in your care, are you set up to handle that, or have you thought through that process?
Yeah, we are, and we're paying attention to that on a few fronts. We implemented a segregated receiving area several weeks back, where we're not touching any return packages that come in. So these are non-compliant patients that send their device back. So we put that in place, where the packages are put with a date on them, and we don't touch them for 3 business days. In terms of newly diagnosed, we're very closely kind of following the science, which is, evolving the medical science that is evolving kind of, it seems like daily, and focusing on where BiPAP therapy is going to fall in the treatment protocol. We feel like we can use our existing workflows and pathways to deliver PAP devices to newly diagnosed patients or suspected diagnosed patients. We are in early discussions with partners about a potential hospital diversion plan that would involve BiPAP therapy in the home, but we would do that remotely. We're going to do that the same way that we've done the shipments to date. And again, we've learned a lot about what the right digital resources are to pair with that shipment, and we're going to apply that learning to any positive patients that come our way.
Sure. No, makes a lot of sense. Are you experiencing any equipment shortages, and think concentrators, CPAP, and I realize you're strictly CPAP, but think of that, and then also PPE for your employees. Are you seeing any shortages in equipment?
So we're not. We've been monitoring that one since early January, since we thought of this as sort of a China issue. So with some of the supply chain originating there, we've had pretty open dialogue with our major vendor partners since then, and haven't seen anything since then. Something we will continue to monitor as things move here. PPE shortages are very real. Because we're not seeing patients, it's not as critical a need for us. We are working with the New England Association to potentially distribute PPE, to handle a large bulk order of PPE that we can then distribute to HME providers across New England. We do our bracing business is a consignment model, so that is primarily distributed through hospital emergency departments and urgent care centers. So our technician there, we are continuously supplying him with PPE, and he's sort of begging and borrowing. The situation in these hospitals is very fluid. There's a few of them that aren't even allowing us in anymore. We're delivering and they're stocking. But we look. We're in contact with our colleagues, and we are aware of significant shortages of concentrators and ventilation devices, and anything we can do to support that effort. I know that Brightree is taking steps to support those efforts as well, but it's a tough situation out there, particularly with the concentrators and ventilators.
Great. Well, one thing I wanted to hit on there or follow up on, you talked about the bracing portion of your business. So you're still seeing a need for that product? That product is still being prescribed even with everything that's going on with the hospitals?
Yeah, to a much lesser degree, right? I mean, normal life does not stop. People still break bones and strain and get in car accidents, and require products and services that come through those programs. But look, people are avoiding emergency departments at all costs right now for very obvious reasons. I broke my foot stupidly a couple of weeks ago, and thankfully had one of these braces around and was able to self-treat. It's pretty obvious that it's broken. I didn't need to go to a doctor and embarrass myself and tell a story about playing soccer in the basement with my 11-year-old. So that's happening, right? People are still getting injured, and they're just taking care of themselves at home with rest, ice, compression, and elevation. So the business is off quite a bit there, but we still have to keep things stocked.
No question. And then the final question I have for you, and I've asked a lot of providers this, I think it can be an interesting answer, but what has been your biggest surprise from COVID-19?
To me, the biggest surprise far and away, and I want to preface this by saying the biggest surprise with respect to sort of our company, right? There's been a lot of things that have been very surprising and shocking throughout this whole process, and my heart goes out to everybody on the front lines as they deal with this. But the most surprising thing from a Cape Medical point of view is how seamlessly we have transitioned to this work from home environment. There are people on the call who've been in our building. We're in a 15,000 square foot 2-floor building. Yep. Currently, there are 2 people upstairs. Today, only 1 because I'm at my house. We have these calls that we tick through issues and walk through how the technology is functioning, how the call center is working. And look, if it was if you were a longstanding patient of ours and you were not aware of the COVID situation, you would have seen literally no change in how we are providing service to you. So the resilience of our team members through this process and our ability to conduct business as usual when our entire workforce is at their house has by far and away been the biggest surprise. And look, I think that this whole thing is going to change how work is done in America for a generation to come. We're already kind of evaluating when things go back to quote unquote normal, what are we going to do? I mean, is there really a need for everybody to get in their car and drive into work, 5 days a week? I think we've learned a lot about what we can do remotely, what our capabilities are in this sort of environment, and how great our people are that they can just pack up their boxes and plug in at home and continue to service our patients and partners. So it's been that to me has been far and away the most surprising thing with respect to Cape Medical.
That's fantastic, and that's just gonna bode you well as we do come out of this, and the service that you're getting, your referral sources and your patients, they're going to remember that, and that's just going to help your business. I think that's great information. Well, Gary, thank you very much. We certainly appreciate you being with us and taking time to sort of share what's happening in your world.